He had no complaints, like many men who come to my office for an appointment scheduled by their wives. But as I was asking routine questions, he told me that food sometimes catches on the way down. Since this symptom can be an early sign of cancer, I scheduled an EGD to look at his esophagus with a scope. We were both pleased it wasn't cancer, but I was surprised to find another case of what used to be a very rare disease called eosinophilic esophagitis. It was the second time I ran into this in the last few years, and I was aware of a few children in town who also had the diagnosis. It was one of those conditions you hear about as a med student but never see, except now we're finding much more of it. Eosinophilic esophagitis, or EE, is characterized by an inflammation of the esophagus and the finding under microscope of a special type of white cell called eosinophil. We've learned this diagnosis can occur in young children to older adults with symptoms of reflux, trouble swallowing, even food catching or getting stuck. It's interesting how EE brought specialty groups together. First, the pathologists started seeing more eosinophils on pieces of esophagus biopsied, both by pediatric and adult gastroenterologists and patients referred by pediatricians, internists, and family physicians. Since eosinophils are an indicator of an allergic process, the patients were then sent to allergists who put it together. We've discovered it's generally related to food allergy. Cow's milk, the most common offender, and is treated by avoidance of the allergenic food, by anti-reflux medicines, and by swallowing a steroid spray that is usually used for asthma. And we're not sure why this formerly rare disease is happening more often now, but we have our suspicions. Of course, C-sections can save lives. Baby formula is sometimes necessary, and less dirt means less infections. But we think EE might be secondary to our overly clean environment, sterile baby bottles, and our too persnickety way with the food to which our babies are exposed. Imagine that. There might be an advantage for babies who come down that non-sterile birth canal, who suckle up against mama's breasts awash with normal flora, and who are exposed, not protected, from the dirty world in which we live.